Good morning. Welcome to our special live series called Expert Connections. I'm Julie Holton. I'm the principal strategist and founder of mConnexions Marketing Agency, and I'm so glad that you are joining us this morning as we kick off a new week in this special series. We launched Expert Connections back in March, knowing that we really wanted a way to connect our clients and our community to experts within our network in order to get the information and resources that we all need to navigate this COVID-19 pandemic. You can find all of those interviews with attorneys, CPAs, mental health advisors, and others on our website, mConnexions.com. This week, I'm excited to bring you 4 straight days of live interviews. We love a good roundtable discussion, and so we thought that's exactly what we would bring to you this week. So I can't think of a more important topic to kick off this week than mental health. It's something that impacts all of us in business and in life, of course. And so joining us today, we have 2 mental health experts to talk about this with us. We have Joyce Martyr. She is a psychotherapist, author, and keynote speaker known internationally for her work in mental health. And Christine Kunert is the director of Ellys Place Capital Region, a center for grieving, a healing center for grieving children and teens. So Joyce and Christine, thank you so much for joining us this morning.
Thank you for having us.
Thanks so much, Julie, for being such a mental health advocate. I so appreciate the invitation to be with you today.
Well, thank you. I appreciate having some experts to talk about this. I was joking with my team this morning that this was going to be a good, solid therapy session for me. So for those of you who are tuning in, please feel free to ask your questions throughout the next half hour or so. You have the attention of Joyce and Christine. So let's go ahead and get started. Joyce, I want to start with you. Let's talk about how the pandemic is affecting mental health. What are you seeing in your practice?
Oh my goodness. Before the pandemic, we already were experiencing a world mental health epidemic. And then when you add the pandemic on top of it, the research is saying that 45% of adult Americans are reporting that their mental health has seriously declined since the pandemic. So we were already seeing the highest suicide rates ever, highest rates of depression and anxiety and addiction. And on top of that, we've added the pandemic, which is a massive trauma for us all. We're all trying to wrap our brains around this global event that's impacting our health and safety and finances and every single aspect of our life. So it's a massive stressor. And in my practice, I'm seeing, thankfully, a lot of people seeking mental health counseling and therapy. I am a huge mental health advocate, and I believe we all need therapy or counseling at different points in our lives. And I think it's something healthy and proactive. It doesn't mean that you're crazy or in crisis. We all have physical health like we have mental health like we have physical health, and we need to take care of it. So I love when people reach out for the support that we all need and deserve.
Joyce, you mentioned when we were talking offline, you talked a little bit about how everyone is experiencing trauma and some people are experiencing PTSD. Can you talk about that a little bit?
Yeah, I think oftentimes people think that post-traumatic stress disorder is something that only happens to war veterans or people who experience some horrible catastrophe or life event. And really, the research is saying that on some level, we are all experiencing some form of PTSD right now. For people who have actually had the virus or lost a loved one, the rates are very high. For people who have loved ones who are sick or have been sick themselves, they're also very high. And even for the general population, they're saying as many as 10% of us are experiencing full-fledged post-traumatic stress disorder, which involves stress, anxiety, depression, inability to sleep, insomnia, perhaps some irritability or anger, difficulty concentrating. And we need to understand that this is a normal response to the pandemic. And it's based on our level of personal trauma that we may have in our history. Old traumas get triggered by these current events and kind of brought up to the surface. And we need to be very gentle with ourselves and seek the help that is available and effective.
I love that, being gentle with ourselves. That's so true. We tend to be gentle with the people around us and the people we care about, but sometimes we tend to fall off of that list of people to be nice to. Christine, I want to ask you about the impact on children. This has come up so many times as we're talking, and I think, Joyce, all of the things you mentioned, I hear friends and family and myself dealing with these as adults. Christine, what about the children and teenagers in our lives?
I'm going to echo a lot of what Joyce just said. You know, you can't get away from what's going on in the world, and our kiddos aren't getting away from it. They are, you know, it's on social media. So there's an increase in concentrate, you know, not being able to concentrate, trouble sleeping, trouble concentrating, trouble eating. You know, our kiddos are experiencing a tremendous amount of stress, and they're seeing their parents or their guardians experience this as well, which is adding to their foundation of safety, because we're all feeling, I think, a little bit vulnerable and not knowing what tomorrow's going to bring us.
Absolutely.
Yeah, I would add to that, you know, as the mother of 2 teenage daughters, and I have a stepson who's 21, that there's, you know, we're all experiencing grief and loss. And I think especially for adolescents and young adults, it's really difficult to wrap your brain around why you're not in school, why you can't see your friends. And I loved the article in the Harvard Business Review about that uncomfortable feeling that we're all experiencing as grief. And, you know, I think for the adolescents, it's particularly hard because that's a hard time of life.
Well, and they don't quite have the mental ability to understand it. I mean, you know, a friend of mine is turning 50 tomorrow, and you think it's a great big celebration. You know, it's a milestone. It's different. Now, this weekend, I had a child turn 21. That's a 20-year-old brain. A 50-year-old can process it a little easier. And then you go back to our teenagers, even younger, they don't have the ability to really understand and put it in perspective. They're just not there yet. And that adds to all of the stress of our kiddos. And we know that social media can be a wonderful tool, but right now that's all our kiddos are using. And it also can, if you're isolated, or we are all isolated, it may further that isolation and even further bring out that anxiety and depression.
Exactly.
So interesting. You know, I was talking to my sister who has 3 young children. They're 8 years old, 6 years old, and 3 years old, almost 4. And one of her 8-year-old daughter's friends is an only child who lives with a single mother who's a nurse. And so my sister was telling me about how her daughter is going to get together with this friend, and, you know, and all the reasons why they're going to break the stay-at-home order in order to do this. And I thought, wow, I did not even think about, and there are so many people in situations like this, and for a child to be isolated in such a way and probably worried about her mom and, you know, whatever else she's going through, it really brings perspective on the situation. And I want to ask you too about, you know, Joyce, you were talking about all of the different, you know, types of all of the different ways that the trauma can start to come out, whether it's, you know, insomnia or stress, heightened anxiety. What about, you know, loneliness? Or what about, you know, what are some of the even short-term or long-term impacts? What are we looking at there?
I mean, it's really, truly hard to wrap your brain around. I think all of us are experiencing attachment issues. So we're human beings. We're meant to be connected to one another. And for people who are single or living alone, or your example of the single mom with one child, I have a friend in the same situation. There's a lot of isolation, and that can really trigger depression. We need support from others. So that's why it's so important to use, you know, online support groups and online therapy, and make sure that we're having, you know, our connections with people through social media or perhaps going for a walk, social distance with friends. It's essential for our mental health. And then on the other side, for people who aren't isolated, if they're sheltering in place with their family, there's a lot of relationship conflict that's happening. I have a lot of sessions taking place with people in their cars because they're so mad at their significant other that they need somewhere private to vent for a few minutes. We're all under extreme stress, and it's affecting our attachment, our connection to each other, and our sense of safety in the world.
Julie, you were just talking about your friend who's a single parent with I think what we can all remember to do is, if you know somebody who is in that situation, who doesn't maybe have another adult in the house and with a child, of making a point, because of this connection, of making a quick phone call, sending a quick text. Hey, I'm just checking in. How are you today? And I remember that's always a key question. It's not how are you, because how are you and how are you today are two different questions. And right now, our emotions are like waves, and they could be very calming. It might be a good time, or you might be having a very like a tsunami of emotions coming through, and that reach out may make all the difference.
I love that, Christine. And I would add that sometimes if we're honest about what we're feeling, when someone says, how are you? Instead of saying, I'm great, I'm doing just fine, to say, you know what, this is hard. This is hard. I'm in a funk. My brain is not working. I've said several times, I feel like my brain is like a scrambled egg. Through this experience, I think, if we can talk openly about the depression and anxiety and the fear that we're experiencing, we invite those deeper conversations for people to share with us so we can be a support to them.
Absolutely.
I love that. And we've been talking a lot about social media, both online and offline, the three of us. And I love the idea too, to put those two ideas to talk about scrambled egg brain, put those ideas together, and using social media for good right now, and to be able to share some of those messages and talk about what we're feeling and how we're getting through it, and maybe some things that are helping. Christine, I want to talk a little bit about this open letter that you wrote. And I don't know if it was a week or two ago, but when I've read it many times now. I've shared it with my own team. I've shared it with my family, because I think it touches on, in so many ways, what so many people are feeling. And I pulled part of it. But Christine, maybe you can talk first, before I pull a couple excerpts out, about why you wrote this letter, what really motivated you to share some of your grief and your thoughts and feelings with the community.
Well, I was talking with a girlfriend, and Joyce, I'm going to back up to what you said when you were talking about PTSD and it brings out. I honestly feel I'm going back through. So for those who don't know, 5.5 years ago, my husband was killed by a drunk driver. And at that time, I had 11, a 13, and a 15-year-old. And when a police officer comes in your home in the middle of the night to share that news, it's like your world stops at that moment. And when I was talking to my friend about this, I said, when did you ever think that the world would stop? When would you ever think that the United States of America, it stopped? And as we talked about, I said, I'm watching on social media how people are talking about it, and I am right back where I was 5.5 years ago. You don't know hour to hour what kind of news you're going to get. And so as we talked about it, my friend Margaret said, you should really write a piece about it. And so that's where that all came from. And I think it also is so important that people know you're not alone and your feelings are valid.
I love that so much. And for those of you who are watching, if you haven't read the letter, we'll make sure and share a link so that you can do that. I'm going to pull a couple excerpts out, because Christine, one of the things that really touched me so deeply about this is you've been, of course, so open about sharing your trauma and your family's trauma with the community. And one of the things that really struck me about it is that you recognize in this letter that whatever you are going through, you meaning our audience, whatever people are experiencing, whether it's sadness, whether it seems trivial or not, you validate what they're feeling and you recognize that trauma and that grief. And I think that that's so important because so many people downplay. We downplay what we're feeling and we push it aside and we say, oh, well, someone else is dealing with more than I am. And you two can speak to this better than I can, but that does not seem like a healthy way of dealing with the feelings and things that we're going through.
It's not, because all feelings are okay. And I just had this conversation with a friend. She had a big event recently that she missed, big family affair. And she said, you know what? I'm sad, but I shouldn't be because, my husband's still working, everyone's healthy, everything's good. And I had to stop her and say, you know what? It's okay for you to be sad. Stop saying because everything else, you don't have a right to be sad, because guess what? All feelings are okay. And you had this big milestone event happening for your family that didn't happen anymore. And I think people seem to forget that it's just okay to sit with somebody and it's okay to be sad.
Absolutely. We have to have empathy for each other and self-compassion for ourselves and honor our own feelings. And Christine, I think it's so powerful that you share your story of grief and loss. I can't imagine what that was like for you. And I've studied EMDR, which is a really effective trauma therapy. And when I went through that training, they basically explained that when we experience a trauma like the pandemic, it taps into all of our earlier life traumas. So losses of loved ones or accidents or injuries or health issues that we might have experienced. And we've all, as human beings, had some level of trauma in our lives. And so it's like a web, and the current trauma taps into the old trauma. And that's exactly what happens. It feels like you're back in that moment in time. And that's a completely normal response. It doesn't mean that you've completely regressed. It's just the way our psyches work, because our minds and our bodies can't fully process trauma, and our feelings get stuck in the body. And there's such a powerful mind-body connection that we really need to honor what we're experiencing and be so gentle with ourselves at this time and not compare ourselves to others.
That's so beautiful, Joyce. And it leads right into what it's like you both could have written this, one right after the other. So I'm just going to share a couple and the entire letter. I encourage you to read the entire letter because it really was touching to me. But I pulled just a few pieces out. And Christine says, we are a society that is used to fixing problems fast, but grief is messy. Isn't that so true? That we want to fix this. We want this to be over. We want businesses to be thriving and people to be healthy and back out celebrating the start, the unofficial start to summer. But we don't feel that right now. And so Christine writes, grief is not linear. It is okay to not have answers right now. It is okay to just sit with someone and feel sad. Some days the best we can all do is take things one day, 1 hour, one breath at a time. All feelings are okay. And you talk about that being one of the guiding principles at Ellys Place. And I just think that is so interesting. So during this time, I think that is something that just really speaks to me, that whatever you are feeling, it is okay. Christine, I want to ask you about, we have a couple questions, so I'm getting a little distracted. I want to jump over and make sure we're answering the questions that are being asked. So Cindy wants to know if you can share, both of you, let's start with Christine, how has COVID-19 been affecting those who were already grieving? It's a great question, Cindy.
It's a great question. Grief is isolating to begin with. And then you take this isolation to the next level. I think of our families and our kiddos. If they've experienced the death of a parent, our kiddos are now wondering, and we've heard this from families, what happens if the other parent dies? What's happening? What happens if someone died during this time and you weren't able to go to the funeral? A funeral in our society is a time that we connect. We're going back to that connection that we've been talking about. We connect, we share stories, we start the process of grieving. And that's not there right now. What if you weren't worth the person when they died? Then there's that guilt and that added stress. So there are so many different layers right now with our grieving families. I also think of our families in my situation. When Scott died, he was the primary breadwinner. And so we had a huge economic impact. Now you add on this layer, what's happening is they've had an economic impact and now another one. So the layers upon layers for our grieving families is at times they may be going back to one breath at a time, as I was talking about in my letter.
Yes, I would add to that if you're already grieving or you've experienced the loss of a loved one during this time, that you're probably more likely to experience what's called complicated grief. And complicated grief is something I experienced actually when I lost my mom in my 30s. And it looks a lot more like a major depressive episode. And for me, it meant that I had a very difficult time returning to work. Really just felt, low mood, lack of energy, a lot of apathy, and I needed a lot of support from friends and family and my therapist. So just to recognize that this is an extraordinarily difficult time to grieve because you're not able to see people or hug people or connect and do the things that would otherwise help you feel better. And you may be worrying about having even additional losses. So there are online grief support groups available, and I would recommend tapping into some of those.
Joyce, can you elaborate a little bit more on there's been a big shift, a big pivot in mental health services, which has been really amazing during all of this, because for those of us who can't go to, in-office visits, now we can turn to more, and this was available before, but I think now it's more widespread. Can you talk about how people can seek help and therapy during this time?
Yes, I am very excited about this, and I think it's definitely a silver lining of this pandemic. Prior to the pandemic, only a few insurance companies covered telehealth or teletherapy, and now laws have been put into place that all insurances need to reimburse for telehealth. And some insurance companies have gone as far as to waive the copays entirely for teletherapy, including big ones like Aetna. So big shout out to them. Companies like United Healthcare have set up free 1-800 numbers for 24/7 crisis counseling, whether you're a member or not, which is fantastic. And I think, to find a therapist, one of the best ways is to visit psychologytoday.com. It's a little bit like match.com for finding a therapist. It has their photos and a bit about their education and experience and specialties and what insurances they take. And therapy is a lot more affordable than people think. With insurance, the copay is often, anywhere from $15 to $40 per session. And through community mental health centers, therapy can be free or at a sliding fee rate that's very affordable.
Joyce, you mentioned crisis counseling, and I want to just maybe have you clarify, in case there's anyone listening who thinks, well, yeah, maybe therapy's for me, maybe not. I'm not at a crisis. When should people seek counseling?
I'm all about prevention. We don't wait to go to the dentist until we need a root canal and we're in massive pain. So it's smart to go preventatively and proactively. I make my kids go. I go, my husband goes. It's just part of health and wellness. And right now we're all under stress. So it really can't hurt. And many of us have free benefits through our employee assistance program. So that's another resource that's available. And just don't wait. Err on the side of caution. If you're having problems sleeping, you're noticing irritability, you're noticing you're not quite yourself, reach out and have a little tune-up.
I love that, a tune-up. Yes, I think of my therapist as part of my business care team, right? We wouldn't have a business without a lawyer or a CPA, and just like we should not be running our lives without someone who's qualified to be able to give us the right kind of guidance. Christine, I know that Ellys Place has also made a lot of changes since the start of this pandemic. Can you talk about Ellys Place and the services you provide, and also how you're continuing to provide those services?
So Ellys Place serves grieving children and teens, and we do peer-to-peer support groups. So Monday through Thursday, pre-COVID, we would have anywhere from 50 to 60 families in our building, and the children would be divided by age, and they would be sent to each of their room, and then adults either stayed on site or they went to their own group. And we divide our adults by type of death, whether it's spouse loss, a child loss, suicide, or significant other. And then for an hour, they work together, process their grief. Now, fast forward when we all are on the lockdown, how do we reach our families? And we quickly made a pivot. Ellys Place does things maybe 4 to 6 times a year. We call them family nights. So instead of us all separating to our own groups, we do projects as a family. We have in turn, each week, we reach out to our families and give them a project to do at home. I have an example of one. This is a jar that we made as a family at Ellys, and it's a jar that we decorated things that were about spot, and in there we would write memories of my husband and their dad and put them in there. So each week our families are getting a different project that they can work on. In addition, our bereavement coordinators reach out to them to check in on them. 2 weeks ago, you start off and you quickly want to work with your families, and now we're pivoting even more and starting some Zoom sessions of peer-to-peer support groups. So we've ran 4 sessions so far, working out the kinks and bringing them together. We had someone share with us, she didn't really think she was going to like to do this. I mean, let's face it, this is a little hard, right? But we're all doing it. And she said the moment she sat down and it popped up and she saw her group, it was just like this big sigh, because that you're in it together with them. So Ellys is working really hard. We're taking, and I know this won't surprise you, Joyce, double-digit calls every week from new families. And right now you can't find support. It's difficult to find support. And so Ellys has been able, in the Lance Capital Region area and our 3 other sites, continue to provide this much needed mental health support. Parents often will call and say, how do I tell my children their dad just died or their mom just died? They just need, when you're in such shock, you just need help maybe with the words. So we are still here, and we are so fortunate. Our community has supported us. Our services are provided at no cost to our families. And we are in a big donation gap right now and working to figure that out. But we know, and Joyce, I know you can speak to this, unresolved grief, if we do not address it, the long term is very, very difficult. And if we deal with it now, we are just helping our little kiddos find some peace.
Absolutely. Absolutely. You do such beautiful work, Christine. And yet there are blessings that come with processing grief. I think it carves deep wisdom and empathy into our being. And it's amazing that you use that to help others as well.
And I've seen it, and I knew this. My husband and I supported Ellys Place 10 years before this all happened. I mean, he was a physician and worked in pain management. And he said, do you realize the people that come in addicted to narcotics, that if you dig deep, it isn't a physical problem. They've been, and Joyce, I know you can speak to this, of the many ways that you try and numb yourself. And our goal is not to do that. Find healthy ways so that they don't turn to that. And I often say, when I talk to families, it's like taking a can of Coke. You can shake it up, but at some point it's going to explode, right? And at Ellys, you try and let it out slowly and it comes out. So you're not using something to numb yourself later on.
Yeah, the self-medication with substances is a big issue in our country, and seeking mental health treatment can really prevent that. So I'm really passionate about dual diagnosis, and it's a huge issue in our country. Over 12 million people have both a mental health issue and a substance abuse issue, and only 50% are receiving treatment. So it's so important that and only 8% of those are receiving the right kind of treatment that addresses both. So it's concerning.
Joyce, is there concern that those numbers will increase, especially after, given what we're going through now and this prolonged period of time at home and in seclusion, away from our normal life, and even as life kind of quote unquote gets back to normal, it's far from normal.
Definite concerns, and people's financial anxiety is very extreme right now with the unemployment, and so I'm very concerned about the self-medication of depression and anxiety with alcohol and drugs, and we know the opioid epidemic has been horrible. So yeah, that's a big concern. And I'm so glad that so many workplaces, Julie, when we were talking earlier, you were talking about how you start your team's meeting every week, checking in about mental health. And I think that's another silver lining, is that so many workplaces are now addressing this. I've been invited to do a lot of webinars, and some for technology groups and some industries that maybe didn't previously talk as much about mental health. And I love that people are realizing that that's an important part of caring for their staff, is making sure that they have awareness. And there are great programs like mental health first aid that can help teach people how to have those conversations in the workplace.
I want to kind of stay along those lines, Joyce, because, we're also talking as businesses start to reopen, as people return to the office. I think there's maybe this false sense of, okay, like we're getting back to life as usual. But obviously, as both of you have been talking about, this is not just a short-term impact on our mental health. We're looking at long-term, and the impact is far from over. There are probably heightened anxieties as people actually venture back out into the real world outside of their homes. Joyce, can you talk about some of the symptoms of stress and anxiety, some of the things that you've been talking about that we may not always watch for?
I think, we're all familiar with physical signs and symptoms of stress, like headaches or stomach aches, or the sleep issues we've discussed, or emotional issues like sadness or anger or irritability. But we also have cognitive symptoms of stress, and I think those are easy to forget about. So difficulty making decisions, distractibility, kind of feeling like you're in a brain fog, and also a distortion of time. I think working from home and not having separation between work and home every day has felt like the day before, and our time boundaries are not in the way that they usually are. We don't have the same structure in place. So it can be really disorienting about how much time has passed. And I think people's productivity has really declined as well. And so it's going to be a process going back to work. And I think people have different levels of fear. And, some people may be very afraid to leave their homes and may have pre-existing health conditions and may fear for their health and safety, whereas others may feel very happy and relieved to be leaving home. And I worry about people kind of judging each other on either end of the spectrum, when we need to recognize that we're all having our own unique responses to this and operating with the information that we have at the time in the best way that we can.
Such a great point. We tend to, as humans, compare, and we also tend to judge. I was telling both of you before we went live that I found myself doing that. And just thinking, we make these assumptions about why people are doing what they're doing. And someone gave me the great example of a mother who had a child, a toddler, at the grocery store with her, and being confronted. And, well, how do you know it's not a single mom who has no other choice? Or, so just some of these things, some of these thoughts that we have, especially with social media and the time we spend scrolling through. Christine, you had mentioned that it tends to be a highlights reel. And right now, maybe those highlights feel a little false, or maybe we're not seeing as many highlights as we're used to. But just being careful not to make those judgments. We have a really great question that I want to ask here from Cindy about workplace mental health. Falls right in line with what you were just talking about, Joyce. She's asking, what are some good tools for keeping your team motivated? And I'll add to that too. You were talking about some people might be afraid to leave the home or have some heightened anxiety. What are some good self tools to really help ourselves as we kind of enter this next phase?
Well, I think in terms of keeping your team motivated, I love what you're doing, Julie, and creating a space for mental health. I know a lot of workplaces are having mindfulness practices in the workplace. So kicking off a meeting with a meditation or a moment of reflection, deep breathing, any mindfulness practice is a great way to reduce stress and kind of reboot the mind, body, and spirit and get you synced up to go back to work. I think having workplace wellness seminars to give people practical tools for dealing with stress, for improving their communication and conflict resolution, for creating better work-life balance, that's a way to be of support to your team. And, making sure that they're having, some time for fun and connection. I know even virtually, some people have done fun work meetings like dressing up in costume or having a plank contest. So making sure that you're also doing things just to laugh and connect as a group. And then in terms of self-care and what you can do, just really prioritizing your health and well-being. I loved what Christine said about exercise is so important, and getting outside, making sure you're promoting your sleep, that you're dialing down your expectations and cutting yourself some slack at this time, and recognizing this is a difficult time and you're not going to be performing at your best, and that's okay. And reaching out for lots of support.
And making sure to set boundaries. I would add to that, when you work from home, you could continue to work all day, but at some point you have to step away and say, my day is done, and shut the computer. We all know you could continue to do this, but at some point you're going to become exhausted. So set some boundaries and make sure and be firm with them. And I've talked over and over, your brain, your heart, and your mind. Make sure you're getting the physical activity. Be kind to your heart, be gentle, and learn something new every day. That, I think, is going to help just keep us motivated and fresh.
I love that reminder, Christine, about setting healthy boundaries, because I know that I am definitely guilty of that, especially like you said, when we're working from home. And we have our emails on our phones, we get texts. I've got all these messages coming in even now, and just when 5 o'clock rolls around, the phone and laptop are still here. So such an important reminder.
It's absolutely essential to set some boundaries, I think. And I learned that, obviously, when my husband died, I learned after a while, after the numbness, is boundaries are really important. And I'm going to be, and I talked to my staff about this, you're going to be more productive if you set some boundaries. It feels like, wait a minute, I'm not doing stuff. But if you look at the long term, no, you're actually taking care of yourself, which in turn helps you, your overall sense of well-being.
And it helps you take care of others. If we don't take care of ourselves, we become exhausted, depleted, and resentful, and maybe even not physically healthy. And so it's imperative. I think sometimes we think self-care is selfish, but it's like the oxygen mask analogy on the airplane. You have to take care of yourself first. I know I tell my family, I'm like, okay, I'm having alone time. I'm going in my room. No one knock on the door. No one speak to me. I'm taking a bath. I'm going to read a book. I'm going to watch a fluffy show, and see you tomorrow.
Well, and Joyce, you brought that up, and I say that all the time. It's that airline analogy. The door is shut, and they go through their spiel. You must put your oxygen mask on first before you can help others. We're not used to doing that, but it is so imperative, especially right now. You can help others if you do that first. It's not being selfish.
I love that. It's so important, especially now. And Joyce, I was laughing as you were talking about that self-care moment, because my niece, when she used to say to her younger brother, Xander, leave me alone. I just need some me time right now. And we would laugh. But I said to my sister, you must be really good at self-care for your daughter to be picking up on that. And I think we all need to channel that right now. And that me time might be something as simple as taking a couple hours away, taking a day away, and something that I tell my team, hey, we're not going to be operating at our best. We're going to try. We're going to operate as much as we can at our capacity. But if you need to take time away, if you need, time for mental health, that's just as important right now as getting our work done. We've been very fortunate to continue working this entire time, and we're all very grateful for that. But I also recognize that, we have people on our team who are working with children at home, or who are, dealing with COVID illnesses or a death in their family. And, there's time for work, and there's time to just be true to who you are. And certainly now is time for all of us to be able to focus on what we need as humans, and not just, trying to be the most productive, successful human beings we can be. Christine, you even said just making it through a day. You've got a good track record going, and I love that thought. I'd like to ask both of you, any final thoughts as we wrap up here? And I'll open it up to our audience if you have any final questions before we go. We've really loved having you ask your questions and be a part of the conversation. Christine, I'm going to start with you. Any final thoughts, maybe especially focusing on children and teens at this time?
Grief is messy, and we're all grieving. There is collective grief. And I really like one of the projects that we do at Ellys Place. It's called the Emotion Ocean. And I believe we're all experiencing it. And because grief comes in waves, and it may tickle your toes, it may hit you at your knees, or it may be a tsunami. And our kids are really feeling this right now. But what's on your life raft? So they take little sticks, little popsicle sticks, and they make a life raft. And I think we all need to remember that our kiddos, if they're lashing out, just remember they've got a range of emotions. And you may know that something you just said, didn't realize it caused a little bit of a tsunami inside them. Just to be real kind, remind our kids, okay, what's on your life raft? What can you do to help right now? Because we have just such an range of emotions that you can be really happy at one moment, and then you're really sad. And that's okay, because I'll go back to all feelings are okay. And we need to remember it's okay to be sad.
Yeah, I would add to that I love what you said about feelings, that this is really a time to wrap ourselves and everyone else with compassion, and really extend ourselves a lot of self-compassion and empathy to others. This is not a time for judgment or feelings of shame or inadequacy. All that we're experiencing right now is perfectly normal, and help is available. So, reaching out for support from your friends, your loved ones, your family, being specific about it. I always recommend to people to think about, if you were a cell phone, what would your battery be at? And, I asked my Northwestern students that, and a lot of them were under 10%. And that's not good. We don't get the little red alert. So we need to re-energize ourselves with that self-care and recharge our own battery so that we can stay healthy and well for ourselves and our loved ones. So I really appreciated this conversation today, Julie. Thank you so much for inviting Christine and me. This has been an amazing discussion.
Amazing.
Well,
thank you.
Yeah, this has been incredible. I definitely I filled my cup on my therapy for today. For the moment anyway, I really appreciate you both taking the time and sharing your expertise. This is such an important conversation for us to continue having, even as we continue to inch forward into recovery and we look at what comes next during all of this. So thank you both. I will also make sure to share your contact information in the comments on this post. So for those of you watching, if you'd like to reach out to Joyce Martyr or to Christine at Ellys Place, please feel free to do so, and you'll be in great hands with both of them. So ladies, thank you so much.
Thank you.
Okay, so our conversation is going to continue tomorrow in our Expert Connection series. As I mentioned, we are going to have live roundtable interviews all week long at 11 o'clock Eastern each day. Tomorrow, Wednesday, is going to be, we're going to focus on marketing and business development and sales. Obviously, our world of business development has changed completely thanks to COVID. And so we're going to be talking about some of the tactics that you can take as we shift gears in the business world. So join us tomorrow morning at 11 a.m. Our guest will be Sherry Pash, who is a membership and growth strategist, and Stephanie Barnhill from mConnexions. She's an operations consultant. Thank you so much, and we will see you tomorrow morning.